So as you may know, migraine is actually the second most disabling condition per the World Health Organization, and there are over 36 million Americans who have migraine. And we know that the best treatment for migraine is actually a combination of both medications and preventive treatments. And we know that the best treatment for migraine is actually a combination of medication and behavioral therapy. And there are really well-designed trials to show this, both in adults and in children. The problem is that these behavioral therapies, so cognitive behavioral therapy, biofeedback, progressive muscle relaxation, they're top evidence-based treatments, but unfortunately, patients aren't accessing them. We've done studies showing that only about half of the patients that we refer to headache specialists referred for behavioral therapy actually even initiated making that initial appointment with a behavioral therapist. And so this is really concerning because it's level A evidence-based therapy. It's safe, it's effective, it has long-term benefits, and so it's a real problem that patients aren't accessing this. We then just did a study, and we presented the results at the American Academy of Neurology meeting, which looked at motivational interviewing and whether the impact of motivational interviewing was able to not only increase initiation for the behavioral therapy, but also scheduling behavioral therapy appointments as well as attending the sessions. And we found that the motivational interviewing, this was a randomized controlled trial, but the motivational interviewing did increase the initiation of trying to inquire about the behavioral therapy, but it didn't actually increase the scheduling or the attending of the behavioral therapy appointment. And I think this really comes down to other barriers that are really impeding access to care of these behavioral therapies. First of all, the time and the money. So a lot of times the providers are not taking insurance, and so people are having to pay out of pocket, and it's really not affordable. Or if they are taking some insurance, the insurance companies are pretty limited in what they're covering. It's important for providers to know that it can actually be billed under health and behavior codes, not mental health codes. So to tell patients, don't worry about the stigma related to mental health. And also, even if they don't have mental health coverage, they should still be able to try to get coverage under health and behavior because migraine is the diagnosis. It's not like we're referring them for depression, anxiety, and so forth. But at any rate, it's pretty discouraging that people aren't accessing these safe, evidence-based treatments. This brings us to why we've tried to create other forms of scalable, accessible therapies for behavioral intervention. And that's why we created Relax Ahead, which is a smartphone application that has an electronic headache diary and progressive muscle relaxation therapy.